Hey everyone, I did my project on congestive heart failure. I actually had a patient come into the ER and came in with congestive heart failure, everything to the T. So to understand congestive heart failure, you have to understand how it works throughout your body. Basically, congestive heart failure occurs when your heart muscle becomes damaged or weakened, and your cardiac output actually decreases. Your cardiac output is the amount of blood that pumps to your body each minute. So I have a fun little visual for you. Your heart should actually pump blood through your body in a normal rhythm. So it should look like that. With congestive heart failure, your heart tries to compensate and the blood flow just goes everywhere. So you're not getting enough blood to your body. So I thought that was really fun because you want your heart to pump blood looking in a normal rhythm. You don't want your heart to pump blood throughout your body like that. So because of that, I have Mr. Unknown who came to the ER, and he actually came to the ER. He was fatigued. He was on 85% room air oxygen level. He had swollen ankles. He had +2 pitting edema, which is when you press the extremities and your skin turgor rebound takes longer. His blood pressure was elevated because of all the fluid overload that was occurring. His blood pressure was 188/100. His heart rate, because when you're compensating, your heart is trying to compensate, and all of that, your heart just goes wild and tries to pump more than it can. So therefore, his heart rate was elevated between 110 and 120s. So background history, he had diabetes, high blood pressure. So high blood pressure, you're having all of that blood flow through your arteries and it's weakening your heart muscle, putting too much pressure on your heart. That is a risk factor. And he smokes a pack of cigarettes every day. He did tell me, oh yeah, I eat really healthy. And then I was like, okay, what do you eat daily? And he goes, well, my wife cooks me some lean cuisines every day in the microwave. We heat them up. They're really healthy. They have healthy written on the front of it. So for that, he actually gained 30 pounds in a month for how he was eating. He then told the doctor when the doctor walked in that he quit taking his water pill, meaning his Lasix pill, because he just didn't remember to pick it up. So we officially did diagnose him with congestive heart failure. According to the Cleveland Clinic, heart failure is a very common condition affecting more than 5 million Americans daily. Your cardiologist can help you manage the condition with lifestyle changes and medication, leading to a longer, fuller life. So we understand how congestive heart failure works throughout your body, the weakened heart muscle, and the abnormal rhythm that your heart is pumping blood throughout the body. So what do we do about it? Mr. Unknown had blood tests drawn. He had a whole bunch of laboratory testing, but what does that really mean? What are we checking? What are we doing? For diagnosing congestive heart failure, Mr. Unknown had a BNP done. That is a hormone produced when the heart muscle is damaged. He had a metabolic panel done. That was to check his electrolyte imbalance, and a complete blood count, CBC, to check for anemia, because anemia can mimic symptoms of congestive heart failure. He also had thyroid tests done, because hyperthyroidism and hypothyroidism can actually cause heart failure. So we did all of that, and that's just kind of common amongst all of congestive heart failure patients to diagnose it. Radiology testing was also ordered as well. A chest x-ray was confirmed that Mr. Unknown had congestive heart failure. That is usually the confirmation that the doctors need to admit them to the hospital. From then on, Dr. Yazinski was the cardiologist. He ordered an echocardiogram and a stress test for Mr. Unknown. According to Dr. Yazinski, when we were in an interview together, he told me that other procedures could be ordered in the future for congestive heart failure, such as a nuclear heart scan and a cardiac catheterization. Also a coronary angiography as well. It's more patient-specific, more of what they need to see how severe their congestive heart failure really is. So we know how it's diagnosed. We know how it occurs. We know how it's diagnosed. We know the symptoms of it. So what do we do once we're diagnosed? Is there a cure, treatment? Like, what do we do? Basically, we have to treat the symptoms of congestive heart failure. There is no cure for congestive heart failure, and the doctor did go into the patient's room and make sure that he and his family were aware there's no cure for congestive heart failure. Treatments are relieving the symptoms. You can go ahead and do medications. There are numerous medications out there that will treat the symptoms. Also, diet and lifestyle modifications are key. Medication compliance and diet and lifestyle modifications. You have to work out 30 minutes a day, 5 times a week. It can be anything fun: biking, running, hiking, just to get out there and do anything. You want to limit your salt and water. According to the Center for Disease Control and Prevention, around 1/2 of all people diagnosed with congestive heart failure will survive beyond 5 years. Only about 10% of people diagnosed with the condition survive at least 10 years. Mr. Unknown will not meet the 5-year survival rate. He is non-compliant with his medications, he's non-compliant with the diet, and he's non-compliant with exercising. He does not like to work out. That's an issue all around the world. Compliance is key and education is key. Your heart is the most vital organ, the organ that pumps blood throughout the entire body. Congestive heart failure is dangerous and a life-threatening disease that can be prevented. Definitely the biggest thing I want to encourage everybody to understand is that with congestive heart failure, you feel like you can't breathe. You have pressure on your chest at all times. Your heart is pumping out of control, and you do not want that in your body, what is keeping you alive. So definitely for Mr. Unknown, we recommended lifestyle modifications. Quit smoking, avoid alcohol, get adequate sleep at night, control your blood pressure, maintain a healthy weight, and with medical professional help and a lot of education, you can live a longer, healthier life. Thank you.